Hello, and thank you so much for joining us today for our part two series of the SMGA Recovery Series for second and multi-generational adult former cult members. Today, we will be learning about destigmatizing medical care post-cult, presented by Eva Mackey and C.K. Rardin. C.K. Rardin is a facilitator of the ICSA Connecticut workshop for those born or raised in cultic groups. He was born in California. His parents raised him in a cultic Catholic group, and when he reached adolescence, they signed over their parental rights to the group. CK was then sent to the cult's headquarters in Itaquira, Sao Paulo, Brazil. He stayed in the group till age 26, when he gathered the courage and strength to leave the organization on his own. After leaving, he became a certified EMT, then was certified and joined the American Society of Clinical Pathologists, with he maintains his certification. He now runs his own IT consulting firm in upstate New York and spends much of his time involved in recovery from his experience, working to expose these groups, as well as helping others in their recovery. Eva Mackey, MD, is a second-generation adult former cult member. Her mother became a devotee of an Indian guru in 1975 when she was 1 year old. This particular guru taught a branch of Hinduism, particularly a non-dualistic philosophy which teaches that the self is one with the ultimate truth or reality. Half of her childhood was spent in the ashrams in India, where she and the other children were unsupervised much of the time. Despite the upheavals and instability that characterized her childhood, Eva managed to get out of the cult at the age of 16 and eventually earned her MD from the University of Texas Medical Branch in Galveston. Today, Dr. Mackey has a busy practice, and she lives near Dallas with her husband and 4 children.
My name is C.K. Rardin, and the reason for my presence here today is to discuss my experiences within the cult as regards to my medical issues, along with those mental challenges brought on by my tenure in the cult and dealing with medicine as an SGA. My parents abandoned me to a South American group when I was 11. Their involvement with this group and mine, unfortunately, had begun several years prior, and I walked away from this group when I was in my 20s. I then worked in a hospital lab for several years, which included my certification through the American Society of Clinical Pathologists, a relationship I still maintain. Simultaneously, I was an emergency medical technician in a volunteer capacity until I left the medical field altogether to pursue a career in computer consulting and established my own computer consulting firm in upstate New York, which has been in existence for 26 years now. Since my earliest recollections, I have suffered from psoriasis, which most people see as a skin condition, but is the result of an overactive immune response. As a young child, my mother was ashamed of it and would go to horrid lengths, including scrubbing my scalp over the kitchen sink until I was bleeding. Once in the cult's own doctors told me to simply accept this affliction as a gift from God for the sins of my family. Well, a gift? In any event, I was also instructed by leaders in the group that my attempts to alleviate this condition was pure and utter vanity, and I should allow it to simply exist and endure the suffering. The cult's ongoing approaches to medicine, which included not seeking medical help. If God wanted it healed, I was told, then it would be. And any mental health care support was taboo, except for the mental health facility they maintained for their members in Belo Horizonte, Brazil. I actually stayed at this facility for about a month, which actually resulted in forming my own fears around mental health. While at this facility, I spent one session with the group psychiatrist who, during the entire session, chain smoked and paced back and forth. I almost felt like he needed therapy more than I did. Then he prescribed something I received via IV at his hospital. Then I was taken back to the group's psychiatric center where I slept due to whatever that medication at the hospital was for 3 to 4 days straight, getting up only to go to the bathroom, nibble on some bread, and sip some water that had been left on my nightstand. He, the same group psychiatrist, also prescribed Ativan for my anxiety and Rohypnol for sleeping. In this country, the United States, Rohypnol is considered a date rape drug and illegal. Time prohibits me from expounding on the bizarre trips that the Rohypnol drug led me on. While at this group's psychiatric facility, I witnessed what they called in Portuguese sossega leão, which means to calm a lion, treatments, and treatments that left members without any memory. It was certain view of mine that this facility existed solely to assist the group in the event a member lost it from spilling the beans about the group, thereby exposing them and their secrets. Now, I got to tell you, the sossega leão treatment really impressed me and was a little bit scary. I actually witnessed the gentleman who was on this treatment, and the way the medication worked, and I don't know what the medicine is called in this country or there. I just know that they gave it a nickname to calm a lion. And he had anger issues. And when he would start to get angry, his limbs would start paralyzing, and the angrier he got, he eventually would fall to the floor almost in the fetal position, unable to move. And this was due to a medication that he was taking. Didn't seem therapeutic at all, because the entire time I was there, this was almost a daily occurrence. So I don't know what the benefit of that treatment was. I eventually saw a therapist, despite the group's taboo on seeing therapists. And this therapist, who had been well recommended to me by someone outside of the group, actually validated everything that I was feeling about the group, my fears, my suspicions, and that was very helpful in leading to my being able to walk away from the group. Once out, I went to another therapist, and this therapist literally would fall asleep during our sessions and blamed me for that. He said, "Oh, you have such a soothing, calm voice. It just puts me to sleep." And I actually tolerated that for a while. And then eventually, it took immense strength to leave him, but I did. And I changed to an exceptional, experienced therapist who was familiar with people who had grown up in cults. And she helped me tremendously. Especially adapting to this new world outside the cult. You need to feel the freedom to find a therapist that is right for you. And if the therapist is making you uncomfortable, you have the right to seek another one. And another one. And another one. Sometimes that's the way life is, but you need to be comfortable in therapy in order for the therapy, I feel, to be effective for you to feel it. There has to be an open communication between the two of you, and not any so-called ulterior motives. I've heard from other people who've gone to therapy, and not so great therapists, where the therapist starts telling them what happened to them. And I don't think that's ethical at all. Over the years, I've acquired different ailments and went to different doctors. For the longest time, I would simply accept the poor response or lack thereof to my maladies. Eventually, out of sheer frustration, I decided to return to my medical studies and attempt to get to the root of many of my medical issues. While doing this, I read many papers, several with dissenting opinions from the others. A light bulb went off. If so many doctors differ on opinions about the disease, perhaps I need to seek out doctors that can actually help me. I am grateful now to have a wonderful team of medical professionals, all handpicked by me to assist in my medical issues. Not only has my health improved, but these doctors are accustomed to working with each other for my benefit. To reach this point, though, I had to realize that medicine was something important to reach out to. It was important to be comfortable with my doctor and keep seeking different doctors if I didn't like the direction they were taking or how they were treating me. Mental health, after my experience with mental health inside the group, was probably the most difficult obstacle to overcome. And when I finally embraced it, turned out to be quite rewarding for me. The right doctor, combined with the right course of medication, can literally elevate your daily life. Sadly, I have lost SGA friends who were unable to access medicine because they could not overcome their experiences with medicine in the cult. In certain situations, their passings, at way too young an age, were due to illnesses brought about by the cult, and then once they were out, not addressed in a timely manner. It is my sincere hope that anyone struggling with these issues can overcome them and take care of the life you now have so you can reap a greater enjoyment of this life outside the cult. Thank you.
Hi, I'm Dr. Eva Mackey. I am also a second-generation adult former cult member, and I am here to talk about destigmatizing medical care post-cult. This is me as a child. As Ashlyn already told you, I was raised in India after my mother found a guru and joined his cult. This is me as a child, although that doesn't completely define who I am, because I am also a physician. And I was able to escape my cult when I was 16 years old. And I graduated from high school and I attended St. Edward's University in Austin, got a Bachelor of Science, got my MD from the University of Texas Medical Branch at Galveston, did a residency in family medicine at St. Anthony's residency program in Denver, Colorado. And I am board certified in family medicine. Rockwall's Gym MD is the clinic that I own in Rockwall, Texas. And I have had this clinic for the past 4 years, worked for Baylor. I've been practicing family medicine really for 20 years now. So lots of experience under my belt. But I'm going to talk about the specific barriers that we face as second generation adult former cult members. And I think that I am particularly well positioned to do that, being both a physician and an SGA. Here's an example of some of the lies that we believe that we learned from our cult. Is that my illness is evidence of spiritual failing or a lack of faith, that you need to just rely on God to heal you, that doctors are not to be trusted, they're your enemies, that you don't deserve help, that doctors couldn't help you even if you sought help, or that seeking help is a sign of weakness and that your illness is something to be ashamed of. So hopefully I can help get rid of some of these ideas or help you overcome these ideas as we progress through the talk. And I want you to know, and you may not know this because you may never have received the medical care, appropriate medical care as a child if you're a second or multi-generational former cult member, but everybody needs a family physician, even if you are completely healthy. You need to be having a yearly physical and having preventative health screening done, because doctors can find problems before they're really a problem. For example, women need to be getting their pap smears to screen for cervical cancer. If we find the abnormal cells before they turn into cancer, it is very easy for us to get rid of those and prevent cancer entirely. Another example is you need to know about your blood pressure, your cholesterol, your blood sugar. Treating these things early can prevent heart attacks and strokes. So we all need a family doctor. And you should view your doctor as your partner and advocate in health. Doctors do care about you. Believe it or not, we went to med school because we actually want to help people. And I do want you to know, however, that doctors are not perfect. So just like any other group of people, you'll find doctors who you don't get along with, and you'll find doctors who have personality disorders like narcissism. But you also have the right and the power to find a different doctor, to find a doctor who's right for you. Yeah, that's what this is all about, is finding someone who works for you. And you shouldn't view your doctor as a strict authoritarian figure who needs to be obeyed, but rather a knowledgeable, educated friend who guides you through your healthcare journey. And decisions made about your healthcare should be shared decisions with your doctor. And just a little thing for the religious minded. So I know many people who were raised in cults are atheists, but some of you are still religious and still need to acknowledge God's role in your healing. But you should think of physicians and medical personnel as tools, instruments of God. So you are not abandoning God when you use a doctor. Rather, you are taking advantage of the tools that God has given you to heal. And seeking help is not a sign of weakness at all. In fact, if you're strong enough to recognize that you need help, it is a sign of strength. I want to talk about mental illness because many of us are struggling with mental illness. And even if you're not somebody who was raised in a cult, there's stigma attached to mental illness. Did you know that 1 in 5 Americans experience mental illness? This is not unusual. This does not make you crazy. And if you experience trauma as a child, you're even more likely to experience mental illness. However, I do want you to know that mental illness is very treatable. Just like things like blood pressure, cholesterol, diabetes, this can be treated. And there's good evidence and studies that show that psychotherapy plus medication provide better care, better treatment than either one of those things alone. So I encourage you to use both of those tools. And the medication, I just want to talk to you about the barriers to getting medication for depression or mental illness. So the medication is not going to make you a different person. It's not going to turn you into a zombie. And many of the medicines are affordable. I also want you to know that you are never going to lose control when you're on the medicine. That's not the goal of treatment. You are always in control. And there are many safe medicines with few side effects. And taking a psychiatric medicine is not a sign of weakness. Rather, it means that you are strong enough to use all the tools available to help you with recovery. So I want to start just by talking about the antidepressant class of medicine. So first, I want to start with the selective serotonin reuptake inhibitors, or the SSRIs. So they work at the synaptic junction between nerves, and they increase the level of serotonin between the nerves in those synaptic junctions. Increased serotonin leads to a feeling of increased peace, relaxation, well-being, and can also help with anxiety. And here are some of the common ones that you've seen. So Prozac, Zoloft, Celexa, Lexapro, Luvox, these are some of the good ones. Most of these can be used in pregnancy. Actually, there's a lot of evidence to support treating depression in pregnancy. Much better to treat it. You're likely to have a better outcome and a healthier baby if you treat the depression. We have a lot of evidence to support sertraline or Zoloft in particular. So that one is the first one we like to use in pregnancy. Here, Luvox, this one in particular is a little different, just that it's particularly good for anxiety. So I really like using that one for anxiety. So here's another class of antidepressants, and these are the ones that also act on norepinephrine. so they act on serotonin and norepinephrine, and they can be a little bit more activating than the ones that act on serotonin alone. And some of the common ones in this class are Pristiq, Effexor, and Cymbalta. And Cymbalta is a really great drug for a few other things as well, such as fibromyalgia. So that's pain when there's no pain without like a physical, a physiologic reason for it. Neuropathic pain also, so pain due to injured nerves. And Cymbalta, actually, I've found it to be helpful in people with diarrhea, predominant irritable bowel. And then here's another one, Wellbutrin, and this one works on dopamine and norepinephrine, and it has, apart from being an antidepressant, it does some other things. So it can really help you quit smoking, can help you with weight loss, and it can help you with attention deficit disorder. This one has less sexual side effects than some of the other antidepressants, so it's valuable for that reason. Let me give you a little bit of, just talk to you a little bit about this class of medicine, because it's really a great class of medicine, and it's a very safe class, but I think people have a lot of fears and inhibitions about it. So let me talk to you about how it works. So with this medicine, it's, first of all, it's not addictive. You will not get addicted to this. And it should be, though, a daily medicine. It doesn't work just on an as needed basis. You need to take it every single day, because the medicine has a cumulative effect in your body. And as you stay on it, so you need to stay on it at least a few weeks to experience the benefit of it, and really even longer than that to experience the full benefit of it. And the way you're going to do it is you're going to start on a really tiny, tiny little dose, okay? And that's going to be different from your maintenance dose. You're going to work up to a larger dose. And the reason you do that is because in the beginning, there can be some side effects, okay? But if you start on a small dose, you're going to minimize those side effects. So in the first week or two, you can experience some dizziness, some nausea, fatigue, or insomnia, hypersomnia, dry mouth. Weight gain is not usually a huge deal. You might fluctuate a few pounds, but it's not like a huge thing with this kind of medicine. Sometimes sexual dysfunction can be an issue, and I do want you to talk to your doctor about this if it's a problem. So, all this sounds really scary, but if you start on a really small dose, it's definitely going to minimize these side effects, and then you gradually increase to a higher dose. So let your doctor help you with this, okay? And communicate with your doctor if you feel like if those initial side effects are too strong. Because sometimes you need to just even start on a smaller dose than what was originally prescribed. And I do want to stress with these side effects that although they can feel weird, they're not dangerous, okay? So they're not going to hurt you. They just make you feel weird. So if you experience them, if they're not too bad, if you just reassure yourself they're going to be okay, give it a few days, it'll probably go away, okay? And just like you start the medicine with a tiny little dose and work your way up, you're also not going to stop it all of a sudden. You have to wean yourself off gradually, which doesn't mean that you've lost control. It means, you can still make a decision to stop, but you're going to have to wean off gradually, and let your doctor help you with that, okay? And then talking about how long you're going to be on this, okay? I know a lot of people don't want to take a medicine long-term, but here's the issue. So everybody who takes an antidepressant is going to need to be on it at least a year. And what determines how long you need to be on it is really how long you've struggled with psychiatric illness. If you have had a single episode of depression lasting only a few months, and apart from that, you are a very happy person, no depression, no anxiety, then you can expect to just take it for a year and then wean off. However, like many second generation adults, or multi-generation adults, you may have been struggling with depression and anxiety for as long as you can remember, in which case you need to think of this as being a long-term thing, because when you stop the medicine, your mood goes back to your baseline mood. And if your baseline is depressed, that's what you're going to go back to. So don't think of it as just a few months and you're gone. Think of it as more of a long-term thing. And I also want you to know this. So the first antidepressant you take may not work for you, but everybody responds differently to the different medicines. So just because one didn't work for you, you could try another one and that one could work fine. Also, some people experience this. They may be on a medicine, maybe it's working great, and then a couple of years later, it's not working anymore. Oftentimes you end up having to switch your medicine. That's okay. That's okay. That's normal. Okay, let me talk about anxiety medicines. Okay, here's a common class of anxiety medicines, the benzodiazepines. And so the benzodiazepines can be taken on an as needed basis for anxiety, and they do start working within 30 minutes of taking them. But some things to be aware of with this class of medicine: they do have addiction potential. They are controlled substances, so they are controlled by the DEA. The DEA monitors very closely how many of these are prescribed and dispensed. They are sedating, should not be used with alcohol, and they will suppress your respiratory drive, which means that overdose can occur. And so medicines in this class would be like Valium, Xanax, Ativan, clonazepam. So these are a class of medicines, so they can be very helpful for a lot of people because they get you relief from that anxiety quickly, but as a class of medicine, we do have to be careful with. So there are other medicines that you can use for anxiety that are not benzodiazepines, and I usually try one of the others first. So I go with antidepressants are great, and I had mentioned fluvoxamine before, is great for depression. Buspirone, some of the antipsychotics are actually great for depression. Hydroxyzine, which is an antihistamine that can be used for depression, and propranolol, which is actually more commonly thought of as a blood pressure medicine, but it actually helps with anxiety, particularly if you have the physical symptoms of anxiety, like a lot of like heart racing, sweating, that kind of stuff. The propranolol really helps. Okay, let me talk about the antipsychotics. And I think that, you know, just the name antipsychotic makes these medicines seem even scarier than the antidepressants. But it shouldn't be, though. And these medicines, so if you are diagnosed with bipolar disorder or schizophrenia, you really need to take one of these antipsychotics. And it's really going to help control the manic episodes and the delusions and the paranoia and stuff like that. But many people who are not bipolar or schizophrenic are still on these medicines because they can do other things apart from treat the mania and the paranoia. So here's Seroquel. So I use a lot of Seroquel. Actually, this one is a really strong medicine. It works on dopamine and serotonin receptors, and it's a really good medicine for anxiety, and it will also help you sleep. So I always give this one in the evening before you go to bed. But some people who are having a really hard time with anxiety and they just can't relax, I'll give them some of this Seroquel, but it can also be an add-on for depression. And Abilify is a really great medicine. So it's really good if you're having bipolar mania. It's really good for getting that under control. It can also be used to treat resistant depression. So sometimes you treat somebody with an antidepressant and it doesn't completely control their depression. If you add a little Abilify, it can really help with that. The main drawback with Abilify is that weight gain can definitely be an issue. So that's definitely something to look for with Abilify. Apart from that, I love it, but you just have to be careful of the weight gain. Lithium is actually a great drug. I know there's a lot of stigma attached to that one as well. But I really love this one for bipolar people. It helps with both their mania and depression, and it actually has a lot fewer side effects than some of the other antipsychotic medicines. You do need to monitor levels with this one. And valproic acid is really great for bipolar mania as well. Also can be used for migraines and seizures. And I want to say with this list of medicines that I've been talking about, this list is by no means exhaustive. This is just some of the more commonly used ones, but you're likely to encounter some other ones as well. Okay. So I want to talk to you for a minute, and this is really important. I want to talk to you about the difference between addiction versus dependence. Okay. So addiction is when you continue to use a substance in spite of worsening consequences, okay? So an example is a drunk driver gets a DUI and he continues to drink alcohol, or an alcoholic His wife tells him that if he doesn't quit drinking, she's going to divorce him, and yet he continues to drink alcohol. That is the definition of addiction, which is very different from dependence, which is when your body needs a medicine to function properly. Okay, so, and there are many things that you can become dependent on. So I'm dependent on my cup of coffee every morning. You can also be dependent on your insulin if you're a diabetic, or your blood pressure medicine if you have high blood pressure. So the medicines that I've been talking about, let me see what my next slide is here. Oops, how do I do this? There we go. So the medicine I've been talking about, the only medicine in the class that I've discussed with addiction potential is the benzodiazepines. So that's the Valium, Xanax, clonazepam, Ativan, that kind of stuff. None of the rest of these things are addictive, okay? You do become dependent on them, which means that in order for your body to function normally, you feel like you need them. But that's not something to be scared of. It's just something to understand, because you can still stop these medicines, even though you're going to have some withdrawal symptoms. Like if you stop suddenly, you'll have some pretty bad withdrawal. But that doesn't mean you're addicted. That means you're dependent. You can make a decision. If you and your doctor decide that it's right for you to stop something, that's a good thing for you to do. If you gradually wean off the medicine, you can do it with minimal to no side effects. It's just that you have to plan for it. That's all. Like I said before, plan on being on these for at least a year, but you may need them a lot longer if you've had a lifelong issue with mental illness, psychiatric illness, depression, anxiety, those kinds of things. You may need longer. Okay, so just in closing up here, I want to stress the importance of the therapeutic relationship. And like I said before, you're not going to be able to have this relationship with every doctor, but you can find a doctor who you do have this relationship with. If you're not forming that therapeutic relationship, find a different doctor. There's someone out there for you. And be open and honest. So we want to know what you're feeling. Tell us what you're feeling, and that way we can help you. I mean, if we don't know, we can't help you. Particularly, I also want to mention to be honest and open with your doctor about substance use and abuse. So very common: alcoholism, opioid abuse. These things are, I'd rather say opioid use. Be honest with your doctor about those things. Also talk to your doctor about side effects, okay? Your doctor doesn't want you to be living with side effects. Talk to your doctor, we can help you. And you should feel that your doctor is there to help and support you, and your doctor's office should feel like a safe place. Well, I hope this has helped, and I hope that you all are open to getting medical care, and particularly for mental illness. That's all I have today. Thank you very much. Bye.